This video continues Chapter 12 of OEC 6, looking at substance abuse and poisoning, and in this video we're really going to focus on the correct assessment of someone who has abused a substance or been poisoned. When we begin with patient assessment, nothing changes in terms of our algorithm. Our very first action is to perform a scene size up, pay attention to any potential hazards, and establish scene safety. Now, in that scene size up, it may also be that when we ask for particular resources, one of the resources becomes law enforcement if illegal drugs are suspected. Now, if a toxicological event has occurred, and it could involve public safety or require special handling, make sure that that call to law enforcement or a hazmat team is part of that. A good example might be not necessarily in terms of substance abuse, but in terms of poisoning. If you had an overturned chemical tanker truck, a spill from a chemical storage site, perhaps your resort's water treatment plant and some of the chlorine-containing compounds there, make sure that you call for appropriate resources. Now, from a patient standpoint, when you respond to a toxicological event, it's critical that you take care of scene safety and use your BSI, your standard precautions, in terms of protecting yourself. Always, we want to follow through with primary assessment and ABCDs, and we're looking for life threats in this case. Now, if the incident involves poisoning or substance abuse, it may be that we have to establish a chain of custody looking for evidence of a substance, or in the case of a poison, this will help us from a resource standpoint if we need to later call poison control. We'll manage and transport the patient, especially should they need further advanced life support. So establishing that scene safety then allows us to move to primary assessment and assess the ABCDs very, very carefully. Keep in mind that something like poison that has been ingested, chemical burn, is going to potentially lead to an airway or breathing problem. Other inhalation exposures, same thing, can lead to difficulty breathing. In the case of carbon monoxide poisoning, because it binds irreversibly to the hemoglobin in the blood, we're going to see those patients have profound hypoxia. Opioids and depressants can lower the respiratory drive, same thing. We'll eventually end up with hypoxia, but in this case, because of hypoventilation, the breathing rate slows so much. Cardiovascular effects to watch out for are going to be arrhythmias, dangerous hypotension, or dangerous bradycardia. Assess the patient's level of response on the AVPU scale, and depending on the substance involved, be advised that that can change very quickly. In the secondary assessment, it's really important to collect that sample history and to really pay attention to use or misuse of substances in terms of meds or events leading up to something about exposure to a poison. Depending on the patient's status and their level of responsiveness, this may come from a bystander. When we look for the scene and looking for causes of exposure to either substance abuse or poisoning, just keep in mind some of these things to just watch for in your scene size up. That will also be help us in terms of a secondary survey. It may be just as simple as finding a pill bottle in a pocket during your head-to-toe assessment, and that can give some valuable information about the substance involved. Those could be sent with EMS to the emergency department, and that will also perhaps allow someone in that higher chain of care to consider what other conditions the patient may have. Don't contaminate yourself with some sort of a toxic substance. Remember, secondary to scene safety is going to be BSI. Also in your secondary assessment, just complete your head-to-toe assessment and look for signs of a poisonous substance exposure. That could be, as you're assessing the head and neck and throat, that you've got evidence of vomiting that has occurred. It could be that evidence of an ingested poison, and then a complete set of vital signs will give you some clues as well. Signs and symptoms of toxic substances are presented in Table 12.1 of your textbook. We can take a look at some of those things. Nausea and vomiting for ingested poisons that can be over the counter, such as acetaminophen and aspirin. We can see something like cocaine and the fact that it's a central nervous stimulant leading to an elevated heart rate and elevated blood pressure because of the vasoconstriction that will occur. If you consider something like methane as an inhaled substance, the decreased level of responsiveness because of the subsequent hypoxia and the confusion that can result from that is something to be expected as a sign or a symptom. For some stimulants, apart from cocaine, something like meth, again, watch for the elevated heart rate, the tachycardia, but some other things will show up as well that may manifest themselves in patient behaviors, agitation, and psychosis. Now, specific to one category, which is a nerve agent, this would be either in the case of perhaps an agricultural setting, organophosphate poisoning, which could also occur with pesticides or herbicides. We have these acronyms that you can look for as well. We may see some loss of continence. We may see constriction of the pupils. We may see vomiting or salivation when we are assessing our head to toe and we're looking at the face. And we can also see this considered from the previous acronym, many of the same symptoms. Probably in your best interest to focus on learning these signs or symptoms by choosing one and mastering it.